more people scramble to get tested for COVID-19, there is a growing debate on social media about what's more accurate, a nasal swab or a throat sample. News 8's Shannon Handy spoke with the experts and has the answer in this Verify report.
At most COVID testing sites throughout the county, samples are taken through the nose, and that's been the case throughout this pandemic. But recent social media posts and even some doctors are questioning that technique as it relates to the Omicron variant.
I woke up feeling sick with a really sore throat, back pain, and body aches.
This TikTok video shows journalist Allison Hall first receive a negative result after swabbing her nose.
Weird, because I'm pretty sure I have it, and I think it's the Omicron variant. I was reading online that the Omicron variant actually lives more in your throat.
Then, after swabbing her throat, she tested positive, which was later confirmed with a PCR test. On Twitter, the hashtag #SwabYourThroat is growing, with more people doing the same. Our experts for this story are Sharp-Rees-Steele primary care doctor Jyotu Sanju, professor and chief of infectious diseases and global public health at the University of California, San Diego, Dr. Davey Smith, and the Food and Drug Administration. We asked them, is a throat swab more accurate than a nasal swab to detect the Omicron variant? Dr. Sanju says no, citing what we know so far about COVID-19.
When people have a viral load, the spike protein attaches to the nasal cavity, which is why it makes most sense to have nasal swabs.
Dr. Smith agrees, saying while COVID can live in the throat, the nose is still more accurate.
Our research shows that over a lot of people, it's still the nose picks up most of the infections better than the throat.
Meanwhile, the Food and Drug Administration weighed in as well, saying in a statement, the FDA advises that COVID-19 tests should be used as authorized, including following their instructions for use regarding obtaining the sample for testing. The FDA has noted safety concerns regarding self-collection of throat swabs, as they are more complicated than nasal swabs, and if used incorrectly, can cause harm to the patient. So we can verify, according to our experts, no, a throat swab is not more accurate. Still, some within the medical field disagree, and many people question why someone would have two different results from their nose versus their throat. Our experts acknowledge there is a margin of error with home antigen tests, saying if you have symptoms and are questioning your results, go get a PCR test.
I'm a scientist and I like the experimentation part, but we can't go on anecdote. So one person that had a positive test in the throat versus a negative test in the nose doesn't mean that everybody has that.
Testing is a major cornerstone of controlling the spread of disease. And if it comes out that there are better test mechanisms, then we are sure to hear about it soon.
Shannon Handy, News 8.